Hi guys, I am back with another video on FMG question. So, a farmer with pinpoint pupils, increased secretions and urination. What is the most likely diagnosis? So, in this question, we have a farmer who comes with the complaints of pinpoint pupils. There is increased secretion and urination. So, what is the most likely diagnosis? So option A is the organophosphate poisoning, option B is the opioid poisoning, option C is the alcohol poisoning, and option D is the atropine poisoning. So pause and try to answer this question. What are organophosphates? So these are chemicals which are used in the insecticide and herbicides in agricultural settings. When individuals are exposed to these compounds, either through direct contact or inhalation, they can experience a range of symptoms. Now, they act indirectly through inhibition of cholinesterases. Now this cholinesterase it is the enzyme that terminates the action of endogenous acetylcholine. So therefore, increasing the concentration of acetylcholine at a neuromuscular junction. As a result, there is accumulation of the acetylcholine in the body, causing overstimulation of a cholinergic receptor throughout the nervous system, including the muscles. Pinpoint pupils, also known as miosis, are a common symptom of organophosphate poisoning due to overstimulation of a parasympathetic nervous system. Increased secretions like excessive sweating, salivation, and tearing they are also typical manifestations. Additionally, increased urination polyuria can occur due to the effect of these compounds on the kidney. By these compounds, they mean the organophosphates. Okay, so organophosphates can also cause the muscle weakness, fasciculations, muscle cramps, and paralysis. What is opioid poisoning? Opioid poisoning occurs when we take opioid in excess. And opioids are the class of drugs that include prescriptions painkillers like oxycodone, hydrocodone, and morphine, as well as illegal drugs like heroin. Opioids bind to opioid receptors in the brain and spinal cord, affecting the central nervous system and producing various effects. Now, effects like respiratory depression. Opioids act on brainstem where they suppress the activity of respiratory centers. This can result in slowed or shallow breathing, also known as respiratory depression. In severe cases, it can lead to respiratory arrest where breathing stops altogether. Now, pinpoint pupils can also be seen in the opioid poisoning. Okay. In a combination with the GI symptoms, overdose and potential death, cardiovascular effects can also be seen in the opioid poisoning. Okay. Now, alcohol poisoning. So, alcohol poisoning occurs when an individual consumes a dangerously high amount of alcohol in a short period. It is a severe and potentially life-threatening condition. When excessive alcohol is consumed, it can overwhelm the body's ability to metabolize and eliminate alcohol, causing buildup of toxic alcohol levels in the bloodstream. Now, this alcohol is very poisonous to, to the to our body by CNS depression, uh, respiratory distress, vomiting and aspiration, hypothermia, dehydration, and electrolyte poisoning, imbalance, and cardiac arrhythmias. Now, atropine poisoning. So, atropine poisoning occurs when an individual ingests, inhales, or is exposed to excessive amounts of atropine or atropine-like substance. Atropine is a medication derived from a plant, Atropa belladonna, and belongs to the class of anticholinergic drugs. It is commonly used in medical settings for various purposes like dilating pupils, uh, reducing secretion, and treating certain medical conditions. However, when taken in when it is taken in large doses, it can cause poisoning effects in the body. Now, symptoms and effects of atropine poisoning include dryness of mucous membranes, dilated pupils, mydriasis, increased heart rate, flushing and warmth due to vasodilation, cutaneous vasodilation, decreased GI motility, and confusion and altered mental status, and urinary retention. So, what will be our answer? So, it will be organophosphate poisoning. Why? Because in the organophosphate poisoning we see the pinpoint pupils like miosis, that is a contraction of pupils, and increased secretion is also seen because there is overstimulation of parasympathetic sympathetic nervous system, and also there is a increased urination. So these all signs and symptoms they point towards the organophosphate poisoning. Okay, thank you.